Hello everyone, I am Joel Mart, Assistant Professor, Department of Pharmacology, School of Pharmaceutical Sciences, VISTAS. Today I am going to discussing about the route of drug administration. The route of administration determines how a drug enters the body. The choice of route can significantly influence the drug's onset, effectiveness, safety and duration of action. Let's see why the route matters. First thing is going to discussing the target delivery. The route determines how quickly a drug reaches its target tissue or organ. The example, salbutamol administered by inhalation directly reach the respiratory tract and produce the bronchodilation with relatively rapid onset. The next is PK profile. It affects onset, peak concentration and duration of action. PK means pharmacokinetics. It's defined as what the body does to the drug. The route can significantly affect onset action. Means how quickly the drug start producing an effect. Second thing is peak plasma concentration. It means Cmax, the highest concentration achieved in the blood. Next is time to peak concentration, means Tmax. It means how long it takes to reach the maximum concentration. Next is duration of action, how long the drug remain effective. The last is bioavailability, the fraction of administered dose that reach the systemic circulation uncharged. Example, a IV injection generally produce a faster onset and higher initial plasma concentration than the same drug given orally. The next is efficacy and safety. Choosing the wrong route reduces the efficacy or increasing the risk of adverse effect. The route must be selected according to the therapeutic objective and safety requirement. An appropriate route may result in insufficient drug concentration at the target size, delay therapeutic effect, excessively high plasma concentration, increase the adverse effect, and local tissue irritation or injury, and also poor patient compliance. For efficacy and safety, the example is insulin. Insulin is generally administered subcutaneously because the oral administration would result in degradation of the peptide in the gastrointestinal tract. Similarly, some drugs require IV administration when a rapid or predictable effect is necessary. The next is ADME framework. ADME means absorption, distribution, metabolism and excretion. Absorption means the movement of the drug from the administration site into systemic circulation. Distribution means the movement of the drug from blood into tissue and organ. Metabolism means the chemical modification of the drug mainly in the liver, although other tissue can also contribute. Excretion means the removal of the drug and or its metabolity mainly through the kidney. The administration of the route can strongly influence this process. Next, we can see one by one of the route of administration. The first route is oral route of drug administration. The oral route of administration is most common and convenient route. Tablet, capsules and liquids are absorbed through the gastrointestinal tract. An important concept is first pass metabolism, where the drug is metabolized in the liver before reaching the systemic circulation. Oral drug generally have a slower onset, around 30 to 90 minutes, and the absorption can be variable. Example, paracetamol tablet. The next route of administration is parenteral route. Introducing the three major parenteral route. First route is IV. It means intravenous route. It directly into the bloodstream. Fastest onset and 100% bioavailability will be there. The second route is IM route, intramuscular route. Injected into muscle, commonly used for vaccine and depot preparation. The next route is subcutaneous route. Injected beneath the skin, commonly used for insulin and some biologics. In the parenteral route, the emphasizing that this route bypass the first pass metabolism. IV route administration is particularly important in emergencies because the drug reaches the systemic circulation immediately. The next route is inhalation route. The drug can be administered as aerosol, gaseous or fine powder directly into the lungs. The lungs have a large alveolar surface area allowing rapid absorption. This route is particularly useful for respiratory disease such as asthma and COPD, and it can also be used for general anesthesia. The example drugs are salbutamol inhaler, nebulized drugs and volatile anesthetic drugs. Next route of administration is topical and transdermal route. Topical route is the drug is applied to the skin or mucosal membrane mainly for local effect. Transdermal route is the drug passes through the skin to produce the systemic effect. The transdermal patch can provide sustained drug release and avoid the first pass metabolism. Example, nitroglycerin, nitrocontin and fentanyl patches. The next route is sublingual and buccal route. The sublingual route, the drug is placed under the tongue. Buccal route, the drug is placed between the cheek and gum. The drug is absorbed through the oral mucosa and bypass the gastrointestinal tract and the first pass metabolism. This route can produce a rapid effect approximately 2 to 5 minutes according to the site. Example, sublingual nitroglycerin for rapid relief of angina. The other notable routes are rectal route. The rectal route, the drugs are given as a suppositories or enemas, useful for patients who cannot swallow. It can partly avoid first pass metabolism in the liver. Next route is intranasal route. The drugs are administered through the nose, usually as a spray or drop. Used for nasal congestion, migraine and emergency naloxone. Can provide relatively rapid drug absorption. Next route is ophthalmic route. The drugs are applied directly to the eye, usually as eye drops or ointment. Commonly used for glaucoma, eye infection and inflammation. Provides localized action with limited systemic exposure. Next notable route, intra-arterial route. This route is the drug is injected directly into the cerebral spinal fluid around the spinal cord, used for spinal anesthesia and certain chemotherapy drugs. This is specialized route that must be performed by trained healthcare professional. Next is factor affecting route selection. In this, there is no universally best route. The choice depends on several factors. The first factor affecting of the route selection is drug properties, solubility, stability, molecular size and first pass effect. The next factor is patient factor, age, consciousness, ability to swallow and compliance. Next factor is clinical urgency. Emergencies may require the IV administration. The next factor is desired effect, local or systemic. Next factor is dose scheduling, frequency and duration of treatment. The route selection is a clinical decision based on both the drug and the patient. So I concluded my lecture with 4 important points. First one is there is no single best route for every drug or patient. Second is the IV administration provides the fastest onset and highest bioavailability. The oral administration is preferred when the convenience and safety are appropriate. The fourth is the route should be selected according to the drug properties and the patient clinical requirement. Thank you. Understanding the route is a foundational to the safety effective pharmacotherapy. Thank you so much for watching my video.